Good morning, everyone. Welcome to today's webinar. I am Chloe Tetro. I'm the health coach here with ReadyCare. And for today, we're going to be having a quick old look at what is Wegovy and how does it work. A lot of you might have heard of Wegovy or Ozempic up to a point in the media in the last few weeks. It's kind of blown up all over the world. And its use as a weight loss medication and treatment for type 2 diabetes. So for today, I just wanted to have a quick overview at some of the key points of Wegovy, what it does, what it is it's doing in the body, and some considerations to have with regards potential risk factors, if it's a decision for you or not for you, and looking at some sustainable options along the way. And maybe I'll touch on maybe a myth or two about Wegovy. So to start off with, I wanted to explain one of the key mechanisms involved in Wegovy and how it works with regards a weight loss medication. So Wegovy basically is a mimicker of something that's naturally occurring in the body, GLP-1 or glucagon-like peptide 1. And it's a hormone produced in the gut in response to food intake, specifically carbohydrates. It'll play a role in regulating blood sugar levels and has other functions in the body, like stimulating insulin secretion from the pancreas in response to food intakes like carbohydrates, which will help to transport glucose from the bloodstream into the cells where it can be used for energy or stored for later use. It reduces glucagon secretion. And what glucagon is, it's a hormone that's released from the pancreas in response to low blood sugar levels, which will promote the release of glucose from the liver, which will help to raise blood sugar levels. So GLP-1 helps to reduce the secretion of glucagon, which can help to prevent blood sugar spikes and the crashes that come after that. It also slows gastric emptying, and this is kind of the major one that we hear with regards its pharmaceutical counterpart, which we'll touch into in a second, and where the weight loss aspect can come into it. So GLP-1 slows down the rate at which food leaves the stomach and enters the small intestine, which can promote feelings of fullness and reduce the rate at which glucose enters the bloodstream. So it can make you feel full and it can keep hunger at bay. So rather than kind of being a magic pill, magic shot in this case, because it's an injectable, it can make one feel that way because of the latency in gastric emptying. So it also, GLP-1 also regulates appetite and food intake because of that reason. And lastly, it will help the pancreatic beta cells responsible for insulin in the body, which has been shown to have protective effect on these cells. So the Ozempic and Wegovy will be mimickers of that GLP-1. So with that, all of these positive side effects I've mentioned can occur with taking the medication. And you can see how the weight loss aspect would come into it. So Ozempic then and Wegovy. So what are they exactly? So Ozempic is a started off, let's say. It's an FDA-approved medication, which is semaglutide. So it's an antagonist of the GLP-1 receptors, or hormone, sorry. It's approved for the treatment of type 2 diabetes and is administered via injection. Now, one of the side effects, as we've had a look at, is weight loss because of that delayed gastric response. So weight loss has been one of the parts that actually Ozempic is getting the most publicity about. And what that has actually created is a lot of off-label uses. And what's meant by off-label use is prescription by a doctor for a medication not for its intended purposes. So we've seen across the world a huge demand for the likes of Ozempic, because of its off-label usage, what that has created is actually a shortage of the medication for those that may need it for acute use, if for type 2 management that may need intervention immediately. Where Wegovy comes in, it is the semaglutide at an increased dose for the particular use of weight loss. So it is FDA approved, and it is used for overweight individuals that also present with one weight-related diagnosis. So things like hypertension, high cholesterol, lipid profile irregularity, which of course would be exceedingly linked to insulin resistance that may not have fully formed into the likes of type 2 diabetes. So what is happening there? There's a bit of a world shortage, and I think the kind of main point that I'd like to put forward is that a lot of the uses of Wegovy and Ozempic are very, very much tied to insulin resistance in its variant form. So even polycystic ovarian syndrome, it's been used for weight loss associated with polycystic ovarian syndrome, and it is fast becoming a quick fix that appears to be treating symptoms relatively well, with quite good outcomes from a weight loss perspective specifically, where there are risks associated with the medication, which I'll touch on a little bit, and how it is in fact treating the symptom quite well, but the underlying cause, which the entire time are signals of insulin resistance, which may not have developed into fully blown type 2 diabetes, but that is a spectrum. That's something that happens over time and starts to affect different parts of the body and metabolic health on the way to becoming type 2 diabetes. It is not particularly being talked about that is at the underneath part of it, and what can be done as a sustainable treatment long term, rather than having the short term benefits of something like the GLP-1 mimicker. So one of the big things that is out there in I'm just going to say the social context, but primarily the likes of the internet and people's reviews, and having kind of celebrity reviews around things like that, is you can eat anything you want and you will continue to steadily lose weight. But actually, that's entirely not the case. That's not the mechanisms of how this works. So Wegovy suppresses appetite by slowing down and delaying gastric emptying, as we've mentioned. So you will feel full, and you will feel like you have less of an appetite. But essentially, it's a mechanism where things are slowing down to the point where it would be uncomfortable for you to eat further food. There is a tendency there for people to consume less calories because of that satiation feeling. That's one of the difficulties that patients seem to have when they're using the medication, is that they are finding it difficult in their day, not just to kind of go, oh, I can eat whatever I want, I'm going to have, loads of pizza, loads of this, loads of whatever, but actually getting just the basic amount of calories, which you have to remember is converted in our body to energy. So they're finding it difficult to actually consume more than, let's say, something like 1,000 calories, which actually will show itself as a lack of energy in the body. There's a lack of feeding the basic systems that we need a certain amount of calories for. So things like fatigue is one of the really, really big side effects that people are reporting with it, because from a very fundamental level, there's a difficulty in fueling the body with calories that it actually needs not a mind eating a surplus. So things like, can you eat anything you want and still lose weight? Not to any kind of level. No, that's not really the mechanisms involved with it. The other thing with that is if there is a surplus of calories forced because of the slowing down of the gastric emptying, symptoms like, which actually I'll throw on me old little banner there, some risk factors to consider because it is moving into that territory. So if you think of lots of food going in, or even an average amount of food to fuel a human for the day, with the slowdown of the gastric emptying, what you're going to find, and what a lot of people are reporting as the primary risk factors that they are noticing, is a huge increase in digestive difficulties, things like nausea, things like bloating, things like abdominal distension because of bloating. So that's the abdomen becoming distended, becoming quite large, burping, flatulence, constipation because things are not passing the way that they should. Or on the flip side, your body's um, trying to deal with it, and it causes the inverse, which would be the likes of diarrhea. There is also, excuse me, a loss of lean muscle mass. Now, it is not targeting lean muscle mass as it's where the weight is going. Like some headlines are saying, it is just lean muscle mass that you're losing. It isn't. It's a combination of body fat and lean muscle mass, because it's not specifically targeting fat, it's targeting your entire body weight. So there can be a reduction in lean muscle weight unless individuals up their protein, which is going to be difficult because consuming further calories is going to be difficult on this medication, and not particularly having the energy to fuel resistance training. And resistance training, weights training, will help to keep that lean muscle mass, which has a plethora of benefits to the body that I'll hop onto when we get to the sustainable solutions. But prior to that, I just wanted to have a quick overview at some of the other points. Another thing people are reporting is something called Ozempic face, which is not the most creative name, but when there's too rapid a weight loss, there could be a loss of subcutaneous fat in the skin of the face, especially when individuals are over the age of 30 and the elasticity isn't there as much. So people can develop quite a hollowed look, and that is due to the rapid weight loss of not titrating the medication properly in the way that it should be used. A sustainable amount of weight loss is generally 1 to 2 pounds of weight loss per week. There are individuals reporting up to 10 to 15 pounds of weight loss per week, which is, I mean, in my opinion, that's actually quite a scary number when you realize how the body works. There's also been reported pancreatic issues, kidney issues, and most frightening, I would say, is in some of the rodent tests, semaglutide caused a increase in dose-dependent thyroid C-cell tumors. So tumors of the thyroid were seen in rodent tests, and their life cycle is much quicker. So you can see things through generations or longer term use for their life cycle. Whereas in human life cycles, there is no long-term study being done about that. So it's not a reason not to take it altogether if there is an acute intervention needed, but it is something to keep in mind. And there are studies out there as well with regards to the weight loss aspect, which I think is more telling. So there's one called, this is quite a mouthful now, I have it written here now, Weight Regain and Cardiometabolic Effects After Withdrawal of Semaglutide Step 1 Trial Extension. So that's the name of the paper studied. And it looked at 1,961 adults with a BMI of over 30, so in the overweight category, that were injecting with 2.5 milligrams of the semaglutide per week. So 1 year after withdrawal of the substance, it was found that 2/3 of their body weight, sorry, 2/3 of their weight loss had been regained. And any improvement that they'd found in that time period where the insulin sensitivity was being looked after with that injectable. So the benefits they'd found in the period were a reduction of atherosclerosis plaquing, which is a risk factor for cardiovascular disease, and improvements in the blood lipid profile that they had found when the dosages and the injections stopped. All of their corresponding cardiovascular variables returned to the baseline they had had prior to the intervention with the medication. And this is thought to be linked with something called the phenomenon of receptor downregulation. And what that means is when you're injecting with an exogenous hormone, so something external, a hormone externally, the receptors of your hormonal receptors in your body can become overstimulated. And what that can lead to is the receptors over time become desensitized. So when you remove the medication, this exogenous hormone being injected, there's a desensitization of your receptors. So it can cause a kind of knock-on effect where not only have you regained the original weight, not only has the root cause of the issue not been dealt with, which is insulin sensitivity, primarily manageable through diet and lifestyle factors, but suddenly now there is an actual biomechanical desensitization of those hormone receptors, which is going to make it more difficult to have the body taking over in the way that it should. So quite a bit there already. So what can we do if it's not that option? Are there other options? And yes, of course there are. So it is an insulin resistance difficulty with an insulin resistance and metabolic health type of chronic condition. The primary intervention when you're working with your physician and you may be on medication to help while the primary intervention is going on, but it's dietary and lifestyle factors can be looked at. If there's a problem with sugar metabolism, cutting off the tap of sugar coming into the body will be the best way to manage that. The body doesn't need to deal with excess sugars when there is no excess sugars entering the body. And that sounds quite obvious, but actually it can be as simple as that for managing sugar-related metabolic diseases. Exercise can play a huge role in the production of GLP-1, so that glucagon-like peptide 1 that we looked at, that hormone that regulates blood sugar levels. It increases the secretion of GLP-1 and improves the sensitivity of GLP-1 in the body. And it reduces the risk of insulin resistance. The other thing we looked at that was one of the benefits that people really appreciated from the like of the Wegovy is that satiation feeling and that hormone and appetite balancing. So with a low carbohydrate food intervention, what we find is a leveling of the hormones leptin and ghrelin, which will be the hormones that control your satiation levels, how full you feel after a meal, and your hunger. So there's a very, very natural and sustainable way to do that, to have those come up in the body, to have that be a felt impact of specific intervention changes without going down the medical route if it's something that fits for you. And the other very, very easy way to actually stimulate GLP-1 is to bring up your protein. So high protein diets can increase the expression of the GLP-1 or a receptor that binds to GLP-1 in the body, which can enhance the sensitivity of the cells and the hormones to improve its overall effectiveness in regulating blood sugar levels. So it's a very easy way and very sustainable way to actually make sure that the effects that the likes of the medical Ozempic and Wegovy, the effects that are being mimicked through the being GLP through being mimickers of naturally occurring things in the body. All of these things can be looked at in a sustainable fashion. And if we look at the data that out of the 1,961 adults, which is a sizable chunk of the population studied, or sorry, a sizable chunk of a data set studied, I should say, if 2/3 of the body weight was put back on following the cessation of the medication, and the cardiovascular markers went back to baseline that they were having prior, it is, in my opinion, and in the opinion of the paper, not a sustainable, viable option long term. Whereas things like habit forming around exercise, habit forming around low carbohydrate eating, and habit forming around high protein diets are exceedingly sustainable, and also will not have the added impact of some of the risk factors involved in taking something like the Ozempic and the Wegovy, the ones mentioned. If anything, digestion tends to go very much the other way, where people will report massive benefits in digestive tracts, things like constipation, nausea, bloating, all of those kind of things. So that is the kind of whirlwind tour of Wegovy and how it works. I hope you found the session informative in some ways and demystified maybe some of the aspects, because it's definitely something that is in the media an awful lot. If you guys want to throw in any comments or anything, please do at this point. It is very much in the media at the moment, and I think when something appears too good to be true, it often is. And I think it's important to keep in mind as well that there are no long-term studies done on this. And treating a symptom in acute cases, when an individual, when it becomes very important to do a very quick intervention. Things like the likes of the Ozempic and the Wegovy can be very good as an acute treatment, something that comes in very quickly to manage, but it will continue to treat a symptom, and unless the underlying factors, the root cause, is looked at, it is not particularly sustainable long term. So guys, that's me for this morning. Hope you enjoyed that, and we will be speaking to you guys next time. Have a nice day, have a nice rest of your day, and be curious about some of the articles that come out, and some of the endorsements, and have a look at some of the literature around it if it is something that you're interested in. We'll see you later. Bye.